Chest radiation after breast cancer surgery can cause a lot of muscle and skin tightness in the radiated area. When these structures are tight, they can cause pain and postural changes, which can further contribute to muscle weakness and shoulder and neck dysfunction down the line. I'm Dr. Barfin Mahmoud. I'm an oncology physical therapist, and in this video, I'm going to show you some essential stretches you can do before, during, and after radiation treatment to help you improve your function and flexibility. The severity of the side effects will depend on the treatment dose and the number of treatments you will receive. You may experience early side effects, which typically develop towards the end of radiation or shortly after you finish treatment. Your skin might look red and swollen, and it will be fragile and painful to touch. Early side effects tend to be short-term, and they should resolve within a month or two. On the other hand, late side effects can develop anywhere between a few months after to even a year after you finish treatment. These tend to be long-term side effects. Your skin in the radiated area may look darker and feel tight compared to the other side, and your skin even may feel almost stuck, especially when you're trying to reach overhead. It's essential for you to have a stretching routine in order to prevent these side effects. However, it's the best if you can start that routine before you even start radiation treatment and continue stretching during radiation to maintain your flexibility, and after radiation to continue to improve your flexibility. We're going to go over a series of stretches with their progression. Just start with whichever feels more comfortable for you. It's important to feel mild to moderate stretches with all of these exercises. You can continue doing these stretches even when you start feeling acute skin-related radiation changes. However, keep in mind your skin in this stage will be very fragile, so you want to be very gentle with these exercises in order to not cause a lot of pulling in the radiated area. To perform this exercise, lie on your back with your knees bent. Hold a cane or an umbrella shoulder width apart. Keeping your elbows straight, slowly raise the wand overhead. And once you feel a gentle stretch, either across your chest or in the armpit, stop there and hold for a few seconds. While you're holding it, you can take a deep breath in and really try to relax and let the gravity take over as you breathe out. Then slowly return to starting position. When you're doing this exercise, make sure you're not feeling any intense pulling or pain across your chest, and brace your core so you're not arching your back when you bring the wand overhead. You can do this exercise for 2 sets of 8 to 10 repetitions, holding for a few seconds each time, and over time you can increase your holds to 5 to 10 seconds. Lie on your back with your arms by your side and palms facing up. As you breathe out, start sliding your arms out to the side until you feel a nice gentle stretch either in front of your chest or in the armpit. Once you feel that gentle stretch, hold this position. Take a deep breath in, trying to expand your ribs, and as you breathe out slowly, focus on relaxing a little bit more, and you can slide your arms up a little bit more if you're still feeling a comfortable stretch. If the stretch is too much or you feel pain, scale off a little bit by bringing your arms down slightly. You can do a few deep breaths here and then return to your starting position. With this exercise, you can do 3 sets of 20 to 30 second holds. Lie on your back with your knees bent for comfort. Place your hands behind your neck with your elbows pointing up towards the ceiling. As you breathe out, let your arms fall towards the floor until you feel a gentle stretch across your chest. You can take a few deep breaths while you're holding this position. When you breathe in, allow your ribs to expand, and as you breathe out, focus on relaxing your arms even more, letting them sink towards the floor if the stretch is still comfortable. After 20 to 30 second holds or a few deep breaths, you can return to the starting position. If you're currently undergoing radiation treatment and you're experiencing the acute skin changes, you should focus on feeling very gentle stretching You don't want to cause a lot of pulling, as we want to protect the radiated area while your skin is still fragile. Lie on your side with your knees and hips bent and head on the pillow. You can use a pillow between your knees as well to keep your leg in alignment with your pelvis. Place your hands behind your neck with your elbows stacked on top of each other. As you breathe out, gently rotate your upper back and arm until you feel a gentle stretch across your chest or upper to mid-back. As you open your arm, follow it with your eyes and make sure your bottom arm stays on the floor. You can take a few deep breaths here, expanding your ribs while you breathe in and relaxing a little more when you breathe out. On your last breath in, you can return to the starting position. If you're experiencing the acute skin changes, you can hold 3 to 5 seconds and repeat 8 to 10 times on each side. But once your skin heals, you can hold 20 to 30 seconds, repeating 3 times on each side. We will have the same setup for this exercise with knees bent, head on the pillow, and hands together. With your top arm, slowly reach up overhead without lifting it off the floor. Continue the movement reaching back. You want to rotate your upper back and follow your arm with your eyes, turning your head. At this point, you should feel a gentle stretch across your chest. Hold for a few seconds and then bring your arm across to return to the starting position. You can repeat this exercise 8 to 10 times on both sides. Lie on one side with a pillow under your head. Next, reach up overhead until you feel a gentle stretch on the side of your chest. If your range is really limited and you cannot really go that far, you can rest your hand on your head or on the floor. If you don't feel any stretch at this point, you can go further by keeping your elbows straight and letting your arm fall towards the floor. Again, stop once you feel a gentle stretch. You can start with 5 to 10 second holds, repeating it a few times, but over time you want to increase your holds to 20 to 30 seconds. You can do this exercise 2 to 3 times a day or as needed, and don't forget to repeat it on the other side. Begin on your hands and knees. Slowly lower your hips towards your heels until you feel a nice stretch in your lower back and or on the sides of your trunk. Hold it for 20 to 30 seconds. And if you need a little bit more stretch, you can reach your arms out a little further. After the 20 to 30 second hold, you can return to the starting position and repeat this 3 times. You can also move your hands to one side to target the side muscles more. Again, doing it 3 times on both sides and holding 20 to 30 seconds each time. And if you're unable to get on the floor, you can do the same stretch using either a table or back of a chair. You can do this stretch seated or standing. Clasp your hands together in front of you and lift your arms overhead as far as you can go. Slowly bend to one side until you feel a mild to moderate stretch on the side of your trunk. You can do deep breathing here while you're holding, working on that rib expansion, and then return to the starting position. You can do this exercise for 3 sets of 20 to 30 second holds on each side, and you can repeat it 2 to 3 times a day. Thank you so much for watching. If you found this video helpful, please share it with others who can benefit from these exercises as well. If you want to see more videos like this, don't forget to subscribe below. If you want to learn more about cancer and lymphedema rehabilitation, you can find me on Instagram. And if you're a cancer survivor who wants to get back to fitness, you can join our private cancer fitness Facebook group. Both of these links can be found in the description below.